Another day, another piece of information. Medical ethics is a field of study that examines the moral principles and values that guide healthcare professionals in their interactions with patients, families, and communities. It is concerned with issues such as confidentiality, informed consent, end-of-life care, reproductive rights, research ethics, and access to healthcare. One of the most important principles of medical ethics is respect for autonomy. This means that patients have the right to make decisions about their own healthcare, based on their values and preferences. Healthcare professionals must respect these decisions, and ensure that patients are fully informed about the risks and benefits of different treatment options. Another important principle of medical ethics is beneficence. This means that healthcare professionals have a duty to act in the best interests of their patients and to promote their well-being. They should provide the highest quality of care possible, and ensure that patients are treated with compassion and respect. Non-maleficence is also an important principle of medical ethics. This means that healthcare professionals must avoid causing harm to their patients, both through action and omission. They should not provide treatments that are known to be ineffective or harmful, and should always consider the potential risks and benefits of different treatment options. Finally, justice is an important principle of medical ethics. This means that healthcare resources and services should be distributed fairly, and that healthcare professionals should treat all patients with equal respect and concern. They should not discriminate against patients on the basis of race, gender, religion, or other factors. Informed consent is a key aspect of medical ethics. Healthcare professionals must ensure that patients are fully informed about the risks and benefits of different treatment options, and that they have the capacity to understand and make decisions about their healthcare. Patients must also be given the opportunity to refuse treatment if they do not want to undergo a particular procedure or treatment. Confidentiality is another important aspect of medical ethics. Healthcare professionals must protect the privacy of their patients, and ensure that their medical information is not disclosed without their consent. There are some exceptions to this rule, such as when there is a legal requirement to disclose information, or when there is a risk of harm to the patient or others. End-of-life care is a complex issue that raises many ethical questions. Healthcare professionals must balance the duty to provide comfort and relief to dying patients with the duty to respect their autonomy and avoid causing harm. Patients must be given the opportunity to make decisions about their end-of-life care, and healthcare professionals must ensure that they receive appropriate support and care. Reproductive rights are also an important area of medical ethics. Patients have the right to make decisions about their reproductive health, including whether to have children and what methods of contraception to use. Healthcare professionals must respect these decisions, and provide patients with accurate information about their options. Research ethics is another important aspect of medical ethics. Clinical trials and other types of research must be conducted in an ethical manner, with appropriate safeguards to protect the rights and welfare of study participants. This includes obtaining informed consent, ensuring that the potential risks and benefits of the research are fully explained to participants, and ensuring that the research is conducted in a manner that is scientifically valid and socially responsible. Finally, access to healthcare is an important ethical issue. Healthcare is a basic human right, and healthcare professionals have a duty to ensure that all patients have access to the care that they need. This includes ensuring that healthcare services are available to all, regardless of their ability to pay, and ensuring that patients receive the highest quality of care possible. In conclusion, medical ethics is a complex and multifaceted field that raises many important ethical questions. Healthcare professionals must be aware of the principles and values that guide their practice, and must strive to provide the highest quality of care possible while respecting the autonomy, dignity,